My name is Professor Ron Kneebone. This is the School of Public Policy. Today, I released a paper on the level of income support provided by 3 provincial governments, Alberta, Ontario, and British Columbia, the level of income support provided to people with disabilities. First, let's talk about the need for such programs. The social assistance programs that province has set up are designed for different people who are not disabled. They're generally designed to help people transition from the situation they're in to full-time employment. People with disabilities cannot do this. A recent study showed that only 15% of adults suffering from autism will ever be able to hold a full-time job. There is a need for programs designed specifically for people with disabilities. I've chosen to look at 3 provinces, Ontario, Alberta, and British Columbia, because those 3 provinces, to their credit, have understood the need for a specific program designed specifically for people with disabilities. The first step in identifying the adequacy of income support is to decide what you understand to be the level of poverty. And that's a difficult concept, because in Canada there is no official poverty line. There are, however, different ways of thinking about poverty. One way is to think of an absolute measure. In this measure, what we do is we identify the level of income that is just barely adequate to keep a roof over your head and to feed yourself. We look at a number of other measures too that are somewhat more generous than that. And finally, we look at another idea for identifying poverty, and that's the level of income that the federal government provides to poor seniors. And we think that's appropriate because poor seniors are much like disabled people in the sense that they've not been able to establish a work history, and so they can't collect CPP. They can only collect old age security and guaranteed income supplement. So we compare that measure as well to these measures of income support. So here's what we found. We'll start with Alberta. Alberta provides a level of income support to people with disabilities that is equal to the amount of income support the federal government pays to poor seniors. They also provide a level of income that's well above the level of basic needs, the amount of income just to feed yourself and to keep you housed. Then if we turn to Ontario, we find that in Ontario, they provide a level of income support that's well below the amount the federal government pays to poor seniors and just above the level of basic needs. One of the interesting things about Ontario is that the amount that they've been paying to people on disability has paralleled the income necessary for meeting basic needs. And that suggests to us that the Ontario government has made a value judgment that says the level of income support should just be the amount necessary to meet basic needs, maybe just a little bit more. Then if we turn to BC, it's unique amongst the 3 provinces in that the level of income support BC provides is actually below the income necessary to meet basic needs. We argue that, again, BC has made a value judgment, the government of BC has made a value judgment, that the level of income support provided to people with disabilities should be a little bit less than the amount necessary to meet basic needs. So here's the policy advice that we like to give to the governments of these 3 provinces. Alberta, to its credit, has recently raised the amount of AISH payments to people who are severely disabled to an amount equal to the incomes that the federal government provides to poor seniors, and that's to their credit. What's not to their credit is that they have failed to index those payments for inflation. And so they allow inflation to eat away at those benefits so that the real number of goods and services people can actually buy with this income falls over time. So for example, in the last 2 years, by not indexing those benefits, the government has saved $7 million. That's a small amount for the Alberta government. It's a big amount for these people, and they should stop doing that. Let's turn to Ontario. The citizens of Ontario should be aware that their government has made a value judgment that says that those people with disabilities should receive a level of income just a little bit above the amount necessary to meet basic needs. They also failed to index those benefits, and they should really stop doing that as well. BC, like the other provinces, fails to index these benefits, and they should stop. But they're the most disturbing of all the 3 provinces because the citizens of BC should be aware that their government has established a level of income support for disabled people that is below the level necessary to meet basic needs. This is something that the people of BC should think about and ask their governments whether or not they agree with it. We need to recognize the cost. For Alberta, there is no cost, other than indexing, which I just suggested to you is a small cost. In Ontario, it's a larger cost because their benefits are significantly lower than Alberta, but it's not an extraordinary cost at all, and it's a relatively small percentage of the total amount of revenue that the government collects. Finally, for BC, it's going to be the most expensive of all programs to bring its level of support up to the level that the federal government pays to poor seniors. And if BC citizens find that too high of a cost, they could at least start by raising a benefit equal to the level necessary to meet basic needs. I think it's important to understand that this is not a political issue. This is an issue of how we want to treat the disadvantaged in our society. What we focused on today was the income support provided to people who, through no fault of their own, have suffered a disability. Most Canadians would agree that we should treat these people with dignity and respect. What we did today was try to identify what those levels of income might look like and how these three provinces in particular have acted upon that. I'm Ron Kneebone. This is the School of Public Policy. Thank you for watching.